Hi guys, for today's video I'm going to show you how we helped this girl. These are the before and afters, and her main complaint was she felt her front two teeth were really big. But let's have a closer look at the smile and see what the real problem is. So right, these are all my photos for this case, and we can just quickly look. This is where we started from, and this is where we finished. And let me just show you how we got to that route. So the first thing we're going to do is look at all the pre-ops. So here, front smile, you can see that the teeth are a little bit proclined. And the thing she didn't like is the front two teeth are just stealing the show. All she can see when she looks in the mirror is just her front two teeth. And these are just the retracted shots here and here. So let's just break out into the front shot and have a closer look what's going on there. Right, okay, so if we look at the top teeth, there's quite a lot of stuff going on here. First of all, the midline is canted, but it's not actually in the middle of the face as well. That's a bit of an over-exaggeration of how canted this midline is. We can see that the gum margin is not symmetrical, so the gum margin is lower on this side than it is on the patient's left side, and the golden proportion at the top is completely messed up. So we've got normal sort of average height width ratio on the front tooth. This is a peg lateral, so that's way too small, and this tooth, the canine tooth, is actually rotated outward, and that's causing it to look much bigger in the mediodistal view than it should do. It's totally messing up the golden proportion and totally messing up the overall look of the smile. In the other shot, you saw that it was the front two teeth were proclined as well. At the bottom, we just got a bit of crowding, nothing too amazing to deal with. If we look at the occlusal shot, you can see just how rotated these canine teeth are. And there's some minor crowding at the front there, but you can see how small these little peg laterals are as well. The lower occlusal shows just there's a bit of crowding. This tooth down here, I did attempt to straighten. It was a complete pain, but the patient actually, before she could finish treatment, she was moving to Dubai, so we had to get rid of it. It was upright, and we had about maybe 3-4 millimeters of space, something like that, when we finished. So to cut a long story short, we did brace treatment for her. She wanted upper and lower lingual braces, and this gave us quite a cool opportunity because we could set the laterals up exactly how we wanted them. Right, so we decided to do a lingual brace for her, and this is the Kesling setup. This is done by Wired Orthodontics, and basically I called up Sue, sent her all the photos and everything, and said, you know, what we want to do. Obviously the bottom teeth is nice and easy, just kind of level a line, straighten and close up all the gaps. At the top, I asked her to sort of just level out the gingival margins, so that's the main thing. You can see that the upper left central is now longer than the right one, but also we knew that we were going to do something with these laterals afterwards, so they've been set up for porcelain veneers, so we've set them back a little bit, maybe like 0.3, 0.5 of a millimeter, something like that, just so we've got space for porcelain to go over the top without doing any additional prep. So that was really important in this case. We weren't sure whether we were going to do composite or porcelain, but the planning for this at the outset was critical. So you can see here we're at the end of the brace treatment, and the teeth are all pretty well aligned. The gum margins are pretty symmetrical. I'm quite happy with the way that they look, and this is the day that we actually did the veneer prep. So because we set these laterals up a little bit further back, we did non-prep. Well, that's not absolutely true. Look at this tooth. It's a little bit longer here. So I did do a little bit of prep, and that's just on the incisal edge of this tooth. But other than that, these teeth just cleaned them up, took an impression, and that was it. The way that I do my veneers is basically we just bung a whole load of composite on these teeth, and then it takes a bit of time, and you just sculpt the what you want the actual teeth to look like. This way I can get the line angles exactly how I want them. I can get the width of the teeth. You can see these teeth are not symmetrical because the arch is slightly different on the left and the right, but this is the best way that I get control over what I want the end result to look like. So this, we take an impression of this once the patient's completely happy with the look of these veneers, and Mason at Denzine, he can copy these. He basically scans in the patient approved provisional and gives me an exact copy of the final veneers in a better color. But as you see in a minute, that didn't work out perfectly. So these are just close-ups of the temporaries. Okay. And a couple of weeks later, we get the veneers. I took a few arty shots of those, and this is what they looked like. They were quite nice. They had a nice amount of texture, and they're all pretty thin, and they look good on the model as well. You can see a couple of shots there, and once we put them in the mouth, I wasn't completely happy with the way that they look. Can you see the distal edge of this this lateral is a little bit too pronounced, and the bottom edge of this tooth should be a little bit more upright like that. The distal edge is a little too much there, so I didn't like that, and it was similar. I didn't like the distal edge on this tooth as well. So we sent them back, and really quickly Mason got the end result back to me, and this is what it looked like afterwards. So these are the two porcelain veneers. I was much more happy with the look and the feel of these veneers rather than the ones before, and I think this is about 2 or 3 weeks after cementation of the veneers, so the gum's all healed up and it looks pretty good. Hi guys, so that's everything for this week. I really hope you enjoyed it. I hope you got something out of it. If you want to see the full res photographs, then just click the link down in the description, and that will take you to my website on the blog where you can check out all of those photos. If you got any comments, everything, just again stick it down below, and I'd love to hear what you think. And if you liked it, please like it and please hit share. All right, see you later. Bye.